Hello, everyone, and welcome to the Bioscience Safety webinar. This webinar is organized from Bioscience, and it's very important, this topic to prevent. The topic of the day is to prevent and manage adverse events using hyaluronic acid fillers. I think it's a topic very interesting, and I want to share my knowledge and the knowledge of from bioscience. My name, I'm Dr. Campos. Let me check. Okay, yes. I will introduce me. I'm Dr. Campos, Luis Campos. I'm from Spain, but I live in Italy. I'm a general surgeon, and I work in aesthetic medicine field and aesthetic surgery. And today with me sharing this webinar will be Dr. Travail. He's a great colleague. He's a plastic surgeon and reconstructive surgeon. He lives in Dubai, but he works between Dubai and Milan. And here we have our agenda for today. We will start with talking about how important is to report adverse events and to know the safety of hyaluronic acid. Okay, and then we will talk about the best practice and recommendation for preventing adverse events, adverse effects. And then we will talk about the identification and management of potential adverse events. At the end of our webinar, we will have time to question and answer. So you can do your questions, and we will talk about two cases that some doctors sent to us about adverse events after injecting hyaluronic acid. So we will discuss these two cases. But before to start, I want to present Bioscience. Bioscience is a laboratory, it's a German laboratory. And Bioscience is one of the pioneers in the aesthetic medicine field. He started to create hyaluronic acid around 2001, okay? And the laboratory is very focused about safety, about adverse events, about the safety and the scientific excellence. Bioscience has a HYACORP. HYACORP is one of the first body fillers in the market. It's a biphasic hyaluronic acid, and it's 100% biodegradable and biocompatible formula. They have the line for face and for body fillers, and we have two body fillers, MLF1 and MLF2, and then we have Bioscience has for reference for face with different characteristics between products. One of the main responsible about Bioscience is to create a committee of experts to help people, to help professionals, to help college, to manage complications, to manage adverse events. I'm proud to be part of the committee, together with Dr. Kravite and others two colleagues with international experience, with a lot of experience in hyaluronic acid fillers and to manage complications. And last one, I have to say that the complication rate of Bioscience fillers, it's 0.1%, with a lot of fillers injected in around the world every year. Okay, this is the introduction, and then I will start with my presentation about adverse events using hyaluronic acid fillers. Can I see the presentation, please? Okay, here we have. This is the first presentation, and the focus of this presentation is about reporting adverse events, how important is to report the adverse events that we can find in our practice. In the last years, the market of aesthetic medicine, it's growing, it's increasing, especially Botox procedures with Botox and hyaluronic acid are increasing a lot. So we have to be familiar, to have familiarized about the management of adverse events. We know that the procedures with hyaluronic acid are safe, are effective, and are reproducible outcomes. When we talk about adverse events or adverse incidents, we have to know that we are talking about an event that can cause unexpected or unwanted effect involving the safety of device user, including patient or other persons. If we go to the literature and we search in PubMed literature papers about adverse events, in the last years, especially in the last 7 years, from the 2005, but especially in the last 7 years, there's a growing and increasing of focus and adverse events. In the past, if you go to PubMed and you search adverse events from hyaluronic acid before 2005, the papers are very reduced in number. In the last years, it's increasing the number. So it's important to teach, to training the new doctors about adverse events, about how to manage adverse events. Of course, aesthetic medicine procedures are increasing, so we expected that in the future we will have more adverse events relating to the use of hyaluronic acid fillers. And we have to teach, to train in new injectors, and we have to decide the choice, what kind of hyaluronic acid to choose to do our procedures in our clinics. When we talk about research, okay, and when we talk especially in case reports in aesthetic medicine, case reports in aesthetic medicine is fundamental to our practice because they are very important to insight into rare condition or innovative treatments. And they can, the case reports can complement in the data that we can found or we can obtain from other studies, other multi-center studies, or about randomized controlled studies. When we're talking about aesthetic medicine fields, we need a specialized guidelines to ensure efficacy, safety, and optimal patient outcomes. In this study that you can see in the slide, the developing a consensus-based guidelines, okay, they propose a new guideline about case reporting. The name is Case Reporting in Aesthetic Medicine, the CREAM guideline, okay? And the CREAM guideline contribute to refine treatment protocols, identifying potential risks and complications, and offering guidance in clinical decision making. When we talk about injectors, okay, it's very important the pre-treatment. The pre-treatment is to talk with the patient, to choose the filler that we want to use, and to manage the expectation of the patient and the possible complication that we can find after the procedures. So we have to teach the patients to identify nodules, identify possible possible infection or reaction or incorrect filler placement or other reaction. And we have to teach the patients to differ these different reactions, okay, to identify adverse events, to identify early reaction and delay reactions, okay? And it's very important to teach also the use of hyaluronidase. Hyaluronidase is very safe. Every doctor needs hyaluronidase in his or her clinic, and we have we need a kit with the hyaluronidase, and we need the instruction, very clear instruction, so how to use the hyaluronidase. So we have to teach doctor not only how to inject the filler, but also how to use the hyaluronidase. The other field is to select the product selection. We have a lot of fillers in the market, so we have to discuss with the patient the outcomes that the patient expects to obtain after the procedure. In that, using that, we have to decide what kind of filler we can use or we have to use. We need to know the different rheological characteristics of the filler, and we have to know the potential adverse events of the fillers. We have to use reabsorbable fillers, biodegradable and biocompatible. These are two studies that the bioscience conducted in the past. The first one was a study doing here in Italy involving 35 subjects. The subjects, the patients were injected with HYACORP MLF2 for gluteal augmentation, and the study was between 2018 and 2019, okay, with a follow-up of 6 months, with very low adverse events. 23% of patients presented adverse event, but very low risk adverse events, and 0% present severe adverse events. Another clinical study, the number one, it was conducted in Italy and also in the United Arab Emirates, with 91 patients, okay, using MLF2 and MLF1 for gluteal augmentation with a follow-up of 4 years and 7 months. And again, the rate of several adverse events was 0%. This article is a consensus of the recommendation for pre-treatment and post-treatment for hyaluronic acid procedure. And this article from ISAPS, excuse me, because one ambulance is here, okay? This article from ISAPS proposed the differentiation of the classification of adverse events. We have the common adverse events that can appear in the first 14 days after the injection, and the swelling, redness, and bruising that usually the resolution is spontaneous. Then we have adverse events between lasting 14 and 21 days, and then the rare and severe adverse events after 21 days. We have to put attention or focus in infections, because the rate of infection in hyaluronic acid procedures is very low. The rate of infection is between 0.04% and 0.2%. And it depends of the type of the filler using, the characteristics of the patient and the injection techniques. One issue when we talk about infection is that sometimes we classify infection every reaction after the injection of a filler, inflammation reactions, swelling, redness. Sometimes the papers and we like doctors classify this like infection, but it's not, many times it's not an infection. And the last one, I want to talk about the obligation that we have doctors to report adverse event. Reporting adverse event is not to blame practitioner or other individuals. Report adverse events is good for enhanced patient safety. And it's incredible because when we go to the Congress, there is an increasing evidence of underreporting compared to anecdotal reports. In the Congress, we talk about adverse event, but when we go to the literature, to the papers, we don't find a lot of papers talking about adverse events. HYACORP Bioscience have and has a medical complaint form to fill all the characteristics of the adverse event and to send it to the mail of bioscience. And that's all. But I want to say you that down the image, the screen, you have the box to make question, and at the end of the presentation, we will answer all the questions, and if we don't have any more time, we will send you the replies to your question with email. So now it's your time, Piero. Thanks.
Thank you so much. Very interesting, Luis, and very interesting the topic of today, because I'm sure that the people that is attending is interested in having a good result and to get out from the problems. And the most important thing is, as you said, is to detect and to be immediately active on resolution. I think we can start with my presentation. It's okay. Sorry. Okay. So I'm Dr. Piero Crabai. I'm a plastic surgeon. For people that knows bioscience, maybe I've seen my face during this year. For people that doesn't know me, I'm a trainer of biosciences since the beginning. I have a lot of experience in plastic surgery and reconstructive surgery. And this is very helpful, especially even in aesthetic medicine and aesthetic surgery, because it can give me more possibility to have a safe, to do a safe treatment and to have a successful result whenever it's possible. Even if it looks a little obvious, this presentation is something that always I have to remind when I'm training doctors, even at the beginning, and even doctors that are experts, because the hyaluronic acid treatment is a successful treatment in 99.9%. But we should have a strict precision in following the right protocol, and we have to consider this practice I've seen that it is most important to consider like with surgical care. And after I will explain much better. And then I've seen collecting all the cases that a physician error is more likely to cause serious issues than the product itself. And this is very important. You have to always think and something is happening because maybe you did something wrong or we did something wrong. And this is why when I'm approaching my patient, I have 3-point plan, an algorithm to manage every treatment, and in case to avoid a complication during the filler procedure. The three key points, obviously, are the consultation, the planning of the treatment, and the treatment itself. The consultation is the first step, the first time that you meet the patient. And so the first time you have to ask her and to have a report about the history and about the skin disease or the systemic disease. Skin disease, the most interesting can be the infection that has on the skin, like acne or other infection of Staphylococcus, and or even herpes zoster in treatment of herpes zoster that happened before and after. And after systemic disease, this is another point that we have to check if the patient had something like thyroiditis or arthritis or other systemic disease. That can even have a strange reaction with the filler that we are using. And especially if it's taking a medication, particular medication, or in case if she did some other procedure like fillers or other procedure like power assisted, like radio frequency, laser, and after that we have to detect the allergies in the patient. It's important even to detect if the skin can even receive this treatment, if we have a firm skin in the face or the body, if we have a good tissue coverage, if I mean that the patient is too much skinny or is too much fat, and especially if we have a good thickness of subdermal layer, the layer in which we are going to inject this product, the product of hyaluronic acid. And we have even to exclude some, of course, as I told you before, the affection. And even we have to exclude people or patient that has cancer in treatment and vaccination. Vaccination was interesting during last years, the COVID vaccination that had that creates some problem and some allergy and some cross reaction. And in case the patient has some dysmorphobic disorder, this is very important because nowadays we have the so-called Snapchat dysmorphobia, in which the filters are the one that are making, giving the patient some expectation that we obviously we cannot follow. This is very important even to me when I'm doing a procedure. I just want to see what is your expectation. And then it's interesting even to talk to the patient and to explain that sometimes it's not possible to reach the result that they want to have. So, and after we have, as always in a consultation, we have to create an assessment, detecting the age, the BMI, and then we're most important to take a photography, to take a picture, because the before and after is always important. We have to consider that the requirements of depends a lot from the gender and from the identifies the person. So we have to create, in case more masculine effects, or in case we have to create more feminine effects in the two different sex. And we have to evaluate the ethnicity, because some ethnies like more having enhanced certain particular aspect of the face or the body. And we have even to, as I told you before, we have to understand what are the wants and what really the needs the patients. It's important to sign the consent, and in which we have even to take the financial consent and the consent to have our picture, even to show the other patient in case that we have a successful result. We have even explained the complication that could appear, even the early and late complication, of course. Then there is the planning. The planning is the most important part, because we have to detect the area. We have even know the anatomy. We should know exactly what is the anatomy of the face, what is the anatomy, especially in which layer we have to inject. This is why nowadays they're saying that everybody can inject, even people that doesn't have medical experience. In my opinion, medical experience means the knowledge of anatomy, not of anatomy that you have to, is an exam that you study at the beginning of your course, medical course, but you have always to take in mind that you have to study the anatomy of every part of the body in which you are injecting, because as I told you, this is the way to have a better result and to create a successful treatment. And this is in the face. Obviously, if you want to inject in the body, you have to know in which layer you are injecting, because in the body we have less point of referrals. We have to inject sometimes in superficial adipose tissue and sometimes in deep adipose tissue. And sometimes we have not to cross the muscle, or sometimes we have to be very conservative. This is very important to know, and it's important even to follow in case the courses of anatomy, and to have a good knowledge, as I told you, of every part you are injecting. And basically, you have to know in every part you are injecting which are the facial danger areas. This is a schematical report of the face, and that everybody who starts or is an expert has to know in which part to be injected and which part can be dangerous, always taking under control the injection and even the place where you're injecting, and to follow the patient after you are injected in these areas. And for the body, we have less dangerous area, even if we are going to inject the buttock or injecting other part, we have to consider the anatomy of the area. We have to consider how is the flow of the vessel and how in which plane we have to inject. So it's the anatomy is the basis of your treatment. Then it's choosing the right product, of course. Of course, we cannot use every product in every place. Product characteristics are important: concentration, cross-linking, and toxicity. My experience since a long time, I've seen that patient sometimes is very confused in about the products. Fortunately, there are some serious companies like bioscience that are created for every specific part of the face and the body, for every kind of tissue, a specific hyaluronic acid that is possible to inject in every area. And it's most important to know, and today we have a lot of articles and papers, and we have in conference and congress, they are talking a lot about the rheology property and the cohesivity that is good for integration of the hyaluronic in the tissue. We have to know the viscoelasticity, so for the tissue support, so how much is strong and how much it will give the structure for the tissue, and for the plasticity, how much is spreading, how much is the product helping the nourishment and the softness of the tissue. So for every part of the body, you should know what is the best treatment you have to use. Then we start the treatment. The treatment, it's obvious because people come and you, after you did your practical experience. But the most important thing is how you are doing this. And how to doing this is the way you are doing the treatment, because the treatment is the most important part, and how you prepare this treatment is the most important part of all the treatment. Why? Because you should prepare everything in the hands. And I've seen even other very expert injector that say, okay, we go to inject without having so much attention to the cleaning of the skin, to have an ANTT, I call the antiseptic no touch technique. So everything should have it in your hand. Everything should be close to you. You don't have to run one side and the other. Everything should be ready to do this kind of treatment. And then you should have a good technical flow. A good technical flow, that is always the technical knowledge. And you have to know how you use anesthesia, the depth of placement of your injection, and the angles that sometimes you have to use to reach the most deep or most superficial tissue. The speed of injection is very important because every tissue has can accept a speed of injection that's different from the other. The volume is important. Obviously, if we over-inject the side, maybe we make, even especially for the body, we make the patient super happy at the beginning, but then it becomes a real problem if something can be not be under control. Then we have to choose if we want to use needle or cannula. Cannula and needle are two choices, not you have to use both of them, not one say, no, I use only cannula or just only needle. You should have be able to use both of them. And then you have to, some certain places, especially if you are using needle, go in aspiration, and you have to have straight movements of the cannula or the skin. Then for anesthesia, obviously the part should be anesthetized to give the patient the maximum comfort and to control much better the treatment. And you can have several possibilities that start from the vibration, that is with the hands just distracting the injection, or lidocaine or numbing cream. Let's go, and this is the way you can inject accordingly the product you are using, and you can use the cannula or in every place of the place of the tissue. The needle and cannula, as I told you, the advantage of the needle is it can damage the blood and vessel, but you have more accurate result, and the blunt cannula can be reduced the risk of accidental injection if you have a less control. And injection technique, everybody knows how you're doing, so can be retrograde, anterograde, and we have always to give them not be fast in injecting. And then we have immediate post-care that should be compression in the injection side, using a paranasal cream massage on ice cooling, pain medication. I always suggest my patient, even if I'm doing small treatment, to use ibuprofen in the evening. It's an easy remedy, but it can save you from the swelling of the morning after. And sometimes when I'm doing a lot of injection amount of product, I give antibiotic and then taping in case we have to keep in place the product that we injected. So the rules are to personalize the treatment and adapt the treatment to yourself. To be conscious of your limits and the patient limit, don't do excessive, do not do overdo injection. It's better to reach the result in several sessions. This is the basis, and so we can go on the second if the second presentation is more interesting.
Yes, I think so. Identification and management of potential adverse events. Thank you, Piero.
Thank you. Very good. Okay, as I told you before, the treatment with hyaluronic acid is the most valuable treatment because it's minimally invasive, have given low risk, because we have seen that the risk rate is very low and is very effective. Unfortunately, even in this kind of treatments, we have some problem. We can create some problem. It can be divided in some uncommon adverse and rare adverse events and severe side effects. This has to be detected from the injector, from the doctor, or from who is going to inject the patient, and immediately to take care and to get out from the problem. All the pictures that I'm showing are referring to me from a doctor that I train, and sometimes I receive from them these events, this case, and I try to give them some suggestion. And with the pharmacovigilance board, we can even support all the problem in case you will have with the bioscience product. I hope never you will. So the common adverse events, the first one obviously is the pain. The pain as related to the technique and to the site of injection can be reduced with local anesthesia. And obviously the right technique. And anti-inflammatory therapy in the 3 days after can be helpful. And 2-3 days after, especially if they remain, the pain is still remaining. Cannot control, yes. Okay. The swelling is related to the technique with the needle or the cannula, and the right knowledge of anatomical planes reduce the adverse reaction. This is swelling is easy to see, especially after injection in the body or in the face, and this local reaction. And this is why, as I told you before, I suggest the patient to use ibuprofen or Rechin gel in the first days to avoid this swelling. But it's pretty common, and I will even would say that is really adverse events as a common events. Ecchymosis comes especially when the patient is had an injection that has been too much rude, so it's coming from very aggressive injection and then been a vascular damage. And ecchymosis or bruises are associated or usually a diffuse pain that can even last for a few days. And heparin Rechin gel, and in case the patient is taking aspirin, you have to ask the patient to stop 2 days before any aspirin or any other treatment anticoagulant. And sometimes the bruises are not evident. Sometimes the swelling is only related in the deep tissue. So this is how we have the lump. We can have the lump that are appearing. So in this case, even the lump can appear when the injection that has not been done in the right way. We have aggregation of filler. So anti-inflammatory hyaluronidase can be helpful to reduce these effects. And another common effects is when, especially we have nodules and very low incidence. We have to even to divide the nodules from granuloma. There is a big confusion sometimes in the doctor. They say we have granuloma nodes. Sometimes are only nodules, and the incidence is very low, and depending how much way that is has been injected, especially if you have a more aggregation and concentration of the product in one side of the patient. In this case, the concentration on the lip, maybe smoking or immediately after, or is doing some or is not taking care about the side that has been treated. So the nodules are resolved with hyaluronidase very easily. The rare adverse events, fortunately, we don't see too much. And one of the cases is the late hypersensitivity or immune-mediated reaction, that is allergy. It can be developed after 42 and 72 hours after injection. This is a patient that has been treated for a body filler and immediately had this kind of reaction of all part of the body, itching and burning. So I suggested to immediately to send to a treatment with intravenous steroid for a resolution of the problem. And an acute allergy sometimes can happen. We have, in case we have cross reaction with other product, like some fish or other product cream, especially if you apply some cosmetic after the treatment, can be even create some allergies. We always say the patient not to put cosmetics in, especially with perfume, and can be treated with tablets of metazone, usually 1 milligram per day for 3-4 days, can be the solution. Discoloration is a changing of the color of the skin, and that is happening especially after a long inflammatory response, high production of melanin, and hemosiderin that is in the subdermal layer and is very evident. And this can be treated with bleaching, peeling, or laser therapy, at least for 5 sessions. Even if it is rare, but it happens to see. Infection is rare, and this is why it happened, because it hasn't been taken the right care during the treatment. As I said before, let's say you don't have sterile or clean gloves, you don't clean the skin, or you don't remove the makeup. And usually it not immediately happen after a few days. And it's better to prescribe antibiotics the following day, especially it hasn't been injected in large amount. Don't inject hyaluronic acid in its face because it can spread the infection around the body. But this is a case that is very rare, and this is a late inflammatory recurrent reaction in a patient that has been injected, but she had a problem that is an immunological problem of thyroiditis in treatment. The doctor didn't recall the anamnesis in the right way, but it's not a problem of doctor because sometimes the patient forget to tell this, and she had a recurrent until it's not finished the effects in the body. Sometimes the role of biofilm give this some permanent infection. In this case, we prescribe steroids low dosage and long term, especially if we injected in large amount. And migration, obviously, this depends on the amount of filler and not good indication, especially if the skin is loose or you injected too much. And we have to take care about reducing the product with several sessions of hyaluronidases. Then we have a more severe and injection that are really, really rare, but they are happening. The more people is doing, as I said wisely, Dr. Campos, the more people is doing, the more you see this problem. This is a patient that's been treated from another doctor. She came at my attention and has been injected directly. As you see, it's very interesting in the facial artery, all the facial artery. And the patient, so the doctor didn't detect this and said that is maybe is a sort of infection coming from herpes virus. And what we have to do here, immediately stop the injection if you see that, even especially the patient feels pain. We have to give the patient the baby aspirin to inhibit platelet aggregation, and as soon as possible to fluid the area with hyaluronidase. It's better to overcompensate instead of give less. And if you have a nitropus or spray applied twice a day, this is very helpful if you have in your office, or you can prescribe. I've seen that it's very, very helpful. And at home, the patient can use warm compress and massage in a critical area. And even the use of steroid, from 20 to 60 milligram of prednisone, continued for several days. This is the same doctor that I received the patient, and happened that rarely, and she had a massive infection after injection, or because of the tendency of the patient by constitution, she created a scar that is very evident. Steroid or conservative treatment with laser as much as possible to reduce this anesthetic event. Granulomas are not so rare like we are used to say, because granuloma is always related to a reaction of foreign body, or sometimes of biofilm is a reaction of monocyte cells and macrophagic that are isolating the area and creating a sort of nodules. So this is diagnosis, differential diagnosis with nodules is very evident, because granuloma, it appears after 24 months, and the nodules appears almost recent after the injection. And the foreign body granuloma are very rare. So, and at the time you have to detect this problem, you have immediately to undergo for intralesional steroids or to use, even if the negative, the culture is important to use antibiotic. I've seen that is very good doxycycline, and the patient begins treatment after a treatment of antibiotic. It's possible to use hyaluronidases, not in the same time that we are using antibiotics. This is very important, as I told you before. And let's go on with this is a syndrome that has been detected recently. This is autoimmune inflammatory syndrome induced by adjuvants that are coming when the trigger factors of the adjuvant reduce the reactive capacity, especially in the pro-inflammatory moment that is the time that the not our foreign body, because the Hyaluronic is always foreign body, is detected like a safe. So when this is reduced, especially because the bacteria are reducing this capacity, it starts this syndrome that is coming with the general symptom like weakness, fever, diffuse pain, and the only way is to treatment is with the hyaluronidases and to symptomatic treatments. And turn. Okay. So what we have to say, the basic concept to avoid the 99% of adverse events, I want to repeat that infection of the dermal filler can stem from skin bacteria, highlight important and maintaining cleanness. This is the most important thing, that whenever you are doing injection in the body, your risk of inject even bacteria is very high. To minimize the risk, we have to inject the right amount of quantities of filler slowly during the session, and we have even to sorry, we have to turn that. We have even to think that sometimes when we are going to take our we see the problem, we have to think that the majority of the problem are not coming from the product itself. The product itself is registered and approved from the public health vigilance, especially in the United States or in European communities. So it's completely safe. It's like someone is say go and have an accident with the car and against the wall and say, no, it's the car that is not good. It's the driver that is not good. And so every time we have to think what we are doing, and we have to consider it's like an important treatment, and we should have the maximum successful result with our injector. I finish.
Okay, thank you, Piero. Great session. Thank you. Thank you very much. Now we have 10 minutes to finish. So we have to discuss 2 cases and then to reply to answer all the question of the audience. Okay. In the first cases that we submitted by the audience, it's a case of a 50-year-old patient treated with HYACORP MLF1 experiencing several adverse events, including progressive edema and inflammation starting at the dorsum of the hands and fingers, gradually extending up to the elbows. Unfortunately, we don't have pictures from this case, and we don't have any other informations about the case. Do you have any experience about that, Piero?
Yeah, I've seen cases like that. Usually happen when you are injecting too much in the dorsum of the hands. Should be injected not a big amount. We have to reach at maximum 2.5 ml with MLF1. Or when the patient, after I've seen another case, the patient went immediately, especially here in Dubai, to take some sun after the treatment, or when there is too much cold, and or they're using aggressive aggressive soap. Can happen.
Yes, I had a case in the past. I have a case here in Milan with a woman. She plays tennis. So I recommended her to stop tennis at least for 1 week after the injection. But anyway, she started to play tennis after 2 days or 3 days. So she started to use a lot the right hand, okay, to play tennis. And it was very curious because she suffered the swelling from the right hand and nothing to the left hand. So the movement, the use of the hand, the use of the part that has been injecting can create the swelling of this area. And of course, I agree with you with the quantity of the injection, because when we want to fill all the space, okay, and we inject a lot of product, it's normally that the product can attract its hyaluronic acid, so the product can attract water, and then we can see the swelling in this case.
Right.
And how do you treat this swelling, Piero? With anti-inflammatories or?
I tried. I have to before I try to with a topical cream like a steroid and antibiotic cream, like Gentalin Beta or Fusiquart or something like that. And if it's not responsive, obviously, as I told you, I give always I give Brufen anti-inflammatories because I think a light anti-inflammatory is always helpful. In case I see that it's too much, I make a hole, a squeeze, and eliminate all the product. Just a small hole with a needle 18 in maximum sterility. I eliminate all the product.
Okay, we have some questions from the audience talking about the hyaluronidase and to break down the fillers. And for example, one of our audience, one doctor is question, in case of severe inflammation and tense edema, we should inject hyaluronidase or better to wait till inflammation subsides?
To me, as I told you before, it's better to wait before to control the inflammation and infection, and after to reduce as much as possible,
Especially because when you inject the hyaluronidase during the inflammation period, it's normally with the hyaluronidase to create more inflammation. So it's better to treat the inflammation before and then inject the hyaluronidase. And we have two questions about the dilution of hyaluronidase, the dose that we use of hyaluronidase. In my experience, I don't know you, but I use more or less 300 international units by milliliter when I use hyaluronidase in the face when I don't have any complications, any adverse events about inflammation, blah, 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 only when I have some nodules that I had to break down, okay? Usually I use 300 units, okay? When I talk about body fillers, sometimes I use, for example, for the buttocks, I can use 1,500 units by session.
More or less is the same. I try to, especially in the case of occlusion, as I showed before, in occlusion, I try to inject as much as possible. In case of lumps, I detect the lumps and inject unless I don't feel that the lump is reducing. 300 units is good, especially for the small nodules and something that is possible to control. For the body, obviously, I try to dilute, not use pure, using dilution, and the quantity always is the same, 1,500 dilute in sterile sterile saline, and I maybe I do 3-4 times before resolving the problem.
Especially for body, because my technique of injection, when I inject hyaluronidase in the gluteal area, for example, I do different injections, okay, to complete all the area and waiting to the spread of the hyaluronidase in all the area. So I think it's useful to dilute the hyaluronidase and to spread all the hyaluronidase in all the area treated.
Right.
Yes. Another question about hyaluronidase, but you answered it. When we are talking about vascular occlusion, what is the dilution, okay, and when do you stop the injection of hyaluronidase? The first one, I think you answered.
Yeah.
Because we have to over-treat it.
Yeah, and I didn't show the patient treatment after treatment, but the treatment of the patient showed that she has the occlusion of the facial artery has been treated progressively in 3 days, and progressively the resolution of the problem it has been no, not immediate. I started from the more distal areas, like the tip of the nose and the lips, because there are more risky areas. And then I continuously injecting the greater branch of the artery to have a resolution of the compression around this or the infiltration of the inside.
Okay, and we have other questions. One is, why after 6 to 8 months of injection, there are lumps, residual lump of the filler in the body, always with MLF1? I think the reabsorption of the MLF, I think no, it's the reabsorption of MLF1 is around 12 months. Okay, so sometimes when you inject the filler, you can feel the filler, the lumps of the filler after 6 months or 8 months, because the total reabsorption of the filler MLF1 is around 12 months, and it depends on the patient, because some patients can reabsorb very quickly and some patients can reabsorb very slowly.
Depends from the several things, from the thickness of the subcutaneous tissues. It depends on the way of has been done the injection. It depends from the skin. So there are several situations. Obviously, if the patient after 8 months feels that there are some nodules, yeah, maybe there is something that has went not in the right way. The most important thing is to detect and to resolve the problem, because I've seen in certain cases that when you have these nodules, the patient is not complaining if are not too much evident, just coming because they feel. So you resolve with hyaluronidases, and then maybe after a while you can do another treatment to recreate the volume that she has lost.
And the last question, we have 1 minute to reply to the question.
It's your
Why after the injection, after 4 months after the injection, we can see swelling and nodules despite following the protocol by giving an antibiotic and an anti-inflammatory? I think this is the biofilm. Okay, I think the answer is the biofilm. In my experience, I had some patients with inflammation, swelling after 4 months or 6 months. Okay, and it's the same like the prosthesis, the implant, the breast implant. In our case, when we have a capsulitis, okay, we can have capsulitis after 3 years or 4 years and after the implantation of the prosthesis of the implant, okay, and it's not an inflammatory response. It's only It's not an infection. It's only an inflammatory response to the gel, to the prosthesis, to the biofilm. Okay, and it can repeat sequentially till the total reabsorption of the material.
Yeah, we have to even to tell just 30 seconds that even if you have an infection in the body, the place where the hyaluronic acid is so-called the locus of minoris resistentia. So it's the site where there is less resistance of your body. Obviously, it's like an implant. And if you have an infection from genitourinary or from teeth, all the bacteria go there and then immediately start having these effects.
Yes, of course. Thank you very much, Piero.
Thank you,
and
Luis.
thank you to the audience.
Bioscience.
Thank you to Bioscience to create this webinar about adverse events. That I think that's an argument very important, because we talk in all Congress about fillers, injection techniques, new fillers, but sometimes we don't talk about adverse events and how to manage adverse events. I think, for example, the hyaluronidase is a very good argument to focus another webinar only in hyaluronidase. Thank you very much.
Great.
Thank you to the audience. If you have other questions, you can send the question to Bioscience, and then we'll reply all of the question. And please, if you feel or if you see any adverse events with Bioscience fillers, remember that you have the form to complete, to fill the form with all the information, with all the characteristics, sent to Bioscience. And we are, Bioscience has a committee with 4 doctors to reply and to support you with adverse events. So remember that is very important. Thank you very much, Piero.
Thank you.
Bye-bye. Thank you. Bye.